If it's life-threatening, go to the emergency room.
It mutates every year.
Pneumonia vaccine doesn't mean you're never going to get pneumonia.
Yeah, parasites.
Fever, sore throat, food poisoning.
Your kid has a sore throat and they're feeling crummy. Symptoms lasting longer than 5 and 7 days. Talk to your doctor.
Really rotten at first, right? Ask online all the time. What is your answer for that? Because sometimes I don't know, so I call you. Hi, everyone, and welcome to You're a Doctor, Right? The podcast that answers all of your burning medical questions. I'm here today with Dr. Bhole, who happens to be my brother. Thank you so much, Aaron, for being here.
Thanks for having me.
So Aaron is a practicing internal medicine doctor. And before we get into what an internal medicine doctor is and the questions I have for him, I just want to kind of give a background to the story. So I thought Aaron was the perfect person to have on today because not only is he smart and handsome, but he also is the person I go to with all of my questions. So any of my questions I actually have as a doctor about my kids, or is this contagious, or what should I do like this? I always direct the questions to Aaron.
Well, thanks for directing those questions to me. Hopefully I get some of them right.
You get them all right. The other thing is, when I was doing some research for this podcast and kind of Googling, what are people actually asking? What are people asking the internet about health? And all the questions that came up as the top kind of 5 questions all had to do with internal medicine within your realm of practice. So I felt like it was perfect to have you on to talk about some of these. Does that sound good?
Sure, sounds great.
Before we get started on our episode today, I want to remind all listeners that the content of this podcast is for informational purposes only and does not constitute formal medical advice. Do not delay in seeking professional medical care because of something that you have heard in this podcast. If you have any questions regarding your own health, please talk personally to a doctor or other healthcare professionals. Relying solely on the information provided in this podcast should be done so at your own risk. Now that we're done with the paperwork, let's get started on this episode today. Okay, so before we dive in, why don't you tell everyone, because some of the listeners might not know what an internal medicine doctor does. The name is a little confusing. So can you talk about that a little bit?
Yeah, I feel like that's one of the major questions I get personally during practice. What is internal medicine? Aren't all organs internal?
I think it's a good question. It's a fair question.
Fair question to ask. And my response is internists are people that practice comprehensive medicine for adults.
Okay.
And that deals with all the internal organs, but it doesn't include things like surgeries. And internist is the general kind of platform training for people that go into adult medicine that then can do further specialization from internal medicine. So your cardiologists, your gastroenterologists, your oncologists, all these specialists for adults that you might see in your lifetime, they have all done 3 years of internal medicine baseline training.
Okay.
That doesn't include things like family medicine or pediatrics or surgery. Those are kind of different specialties, but comprehensive adult elderly care, primary care practice, inpatient and outpatient is all within the realm of internal medicine.
Okay, so that makes sense. So all these subspecialties kind of branch out from this realm of internal medicine. And actually, even in our first podcast, Silas and I talked about how we met our intern year. People get confused about that. Our intern year was actually medicine. So we actually did a year of internal medicine as well before we went into our practices. So that's really helpful. So one of the most common questions I saw online was, is XYZ contagious? And I think it makes sense, right? We all have COVID in our rearview mirror. It's kind of behind us, but it's with us every day, just thinking about the history of it and how we're also isolated. So I think whenever one of us gets sick or a family member gets sick, it's a really hard decision on what to do. We want to be cautious and careful, but we also don't want to go into complete isolation for a long period of time like we did before. So I feel like these are really good questions. And you know, is a cold contagious? Is the flu contagious? Is strep throat contagious? Is pneumonia contagious? These are the ones that I kept seeing searched over and over again. So I thought it'd be fun to start on first, if that's okay. And maybe we should start with, what is the difference between a cold and a flu? People kind of use them interchangeably, but there is a difference, right?
Yeah, sure. We could talk about that first. I think it's a great question. In common speech, people often call the common cold a flu, because the common cold can be caused by a lot of different viruses.
Okay.
The common cold is an upper respiratory tract infection that can be caused by not COVID coronaviruses, can be caused by other different viruses that aren't influenza. And influenza has 2 types, A and B. It can cause symptoms, upper respiratory tract infections that are like the common cold, or people can call the common cold. The reason why we distinguish it from other viral infections is the flu can be prevented with vaccines, so get your flu shot, and also can be treated with an antiviral. So
Okay.
a lot of these infectious diseases that are viral in origin that we separate RSV, COVID, flu from other causes of viral upper respiratory tract infections that we call common colds. We separate them because we can either have a vaccine for them or because we can have an antiviral for them. Tamiflu for flu, Paxlovid for COVID, RSV also has a vaccine. So those kinds of things. That's kind of the difference.
So all of these infections are colds, but not all colds are the flu,
Yeah.
correct? So when we talk about the flu kind of refers to specifically, as you said, the influenzas, which we can treat for and we have vaccinations for. There's other specific infections like RSV that we can treat for. A cold is a more generalized term.
Sure. Yeah.
Okay,
A
that makes
more
sense.
generalized term for a viral infection. And I think one of the more, you kind of hinted on it earlier, one of the things that gets confusing is what's the difference between flu or the common cold and pneumonia. And the main difference between them is pneumonia is a broad term. Pneumonia, the first part of that word comes from lungs, and ia is almost like an itis. An itis is an inflammation. Ia is an issue with a specific organ. A pneumonia is an infection of the lungs.
Okay.
So pneumonias can be viral. So influenza infections can cause infections of the lungs themselves. They can get deeper. So you can have viral pneumonias. You could also have bacterial pneumonias. One of the common ones that we vaccinate against is the pneumococcal pneumonias. Prevnar is a vaccine for a bacterial pneumonia. And you could even have infectious, like fungal or other rare mycobacterium, such as tuberculosis, some rare oddball infections of the lungs.
Okay. So let me repeat all of that back to you. So the cold is a generalized term. The flu refers specifically to the influenzas. And then when we talk about pneumonias just mean when these colds or flus or viruses get into your lungs and cause a lung infection.
Yeah.
So a pneumonia can be viral from the flu. It can be bacterial from something like pneumococcal coccus, which we get the vaccination for. But just because you get the pneumonia vaccine doesn't mean you're never going to get pneumonia, because you can get pneumonia from things that might not be protected by the pneumonia virus. And I think that's a big misunderstanding people have. Right? They think that they've gotten the pneumonia vaccine, they're free from ever getting pneumonia, but that's not true.
Yeah, you can get a pneumonia for something that you're not vaccinated against, or, for example, for the flu, it mutates every year. Same with COVID. Your vaccine that you got in the past may not 100% cover this current variant.
Okay.
But even if it doesn't cover this current variant, or you still get sick despite a vaccination, the severity of your infection is oftentimes 40 to 50% less in some studies, particularly for the flu vaccine. So I still recommend, if you're elderly, if you're immunocompromised, if you're on medications that affect your immune system, some of these autoimmune medications, I recommend everyone, if you have cancer, get vaccinated, because it can at least help or reduce severities, even if you get infected by the bug that's covered by the vaccines. And sometimes you can't help it, but you will get infected by another bug that's not covered by the vaccine. And a key question that you had is, well, if I do develop a cold or pneumonia, if you do get one of these infections, how long are you going to be infectious? So I think from our experiences with COVID and the social distancing and isolation, those kind of things, viral infections, you tend to be infectious for about 5 days. After you start showing symptoms. They can last longer too. So I recommend people, if you're feeling sick, make sure you're washing your hands with soap and water. Make sure you wear a mask. You may be infectious for 70 to 96 hours. And I generally recommend about 48 hours if it's a bacterial infection, that you should isolate yourself to prevent infections from bacteria being contagious. The common example is strep throat, which we could talk about in a second.
Okay. And just real quick, one other question, just because, so 48 hours, you could be infectious afterwards, right? And you might even be infectious before you actually develop symptoms too, right? So, I mean, obviously that's very hard to prevent if you're asymptomatic. So that's just kind of part of life, I think, but it is something to kind of remember. Yeah. Pivoting to strep throat. I'm so glad you brought that up. Okay. This is one that's going to sound kind of funny, but it's one in our family I'm almost happy when I hear it's strep throat causing someone to feel badly. Not that I want anyone in our family to get sick, but strep throat is one of those, in my experience, particularly for the kids, they feel really rotten at first, right? Fever, sore throat. My kids always present not even with sore throat or fevers, but they start with a belly ache, which is common.
Mm-hmm.
Some kids can start with rashes, but then they start feeling really, really bad. But once you get the diagnosis, you can get the antibiotics on board
Mm-hmm.
and they start to feel better after, the first round of antibiotics. And really after, 24 to 48 hours, usually 48 hours, right? You
Mm-hmm.
can go back to school and you're feeling better. If you're afebrile, you should check with your school to see what their recommendations are in your pediatrician. But it's really amazing. It's not like these viral infections that might last weeks and weeks on end. Is that kind of a good way to think about about strep throat?
That's exactly how I think about it. It kind of comes back to that pneumonia having viral and bacterial causes, pharyngitis or inflammation of the pharynx.
So there
or the
again,
back of
itis, inflammation, pharynx,
back of your
inflammation
throat.
of the
Yeah,
pharynx.
yeah.
Okay.
They can be viral and kind of resolve on their own, or they could be from bacteria like streptococcus. And the only way to know the difference is to have a strep test done. So that's one of those things where if you think your kid has a sore throat and they're feeling crummy, it's worth going to an urgent care or a pediatrician office to get the strep test done. Because, like you said, without a penicillin like amoxicillin, that symptoms can last up to a week, 2 weeks. But if you get them antibiotics on board early for a bacterial sore throat, they're generally contagious 24, 48 hours, and they can be back in school after 2 days.
Okay.
But I'm not a pediatrician. I would say talk to your pediatrician.
Talk to your pediatrician, but it is nice that you have the antibiotic option. You touched on the urgent care, and I want to come back to that. Before we do that, I just want to round out kind of this infectious kind of a theme that we're going with here and just touch on a gastroenteritis. So again, we're talking about itis. We're teaching the listeners about how these words are derived. So gastritis, kind of inflammation of the stomach, or what we can talk about as being food poisoning, right? So people ask online all the time, how long is food poisoning contagious? Can you talk a little bit about that?
Yeah, sure. And again, coming back to that theme of infections can come from a variety of different bugs. Gastroenteritis or any of these food poisonings can be caused by bacteria. E. coli is a common one that people hear about, Chipotle or whatever, having E. coli in their food supply. They can be viral. A big one this year was norovirus, which is a pretty tough one. You kind of get nausea, vomiting, diarrhea, quick onset, lasts 72 hours, goes away on its own. It can be from various parasites that people, Giardia, these are things that can get into food, into water supplies. They can even be from toxins, sometimes preformed in seafood or other things. So there are a lot of different causes of food poisoning. Generally, what I tell people is no matter the cause, most of the time they go away on their own.
Okay.
So supportive care, good hydration, making sure if you need something like anti-nausal medication, there's some things available over the counter, anti-diarrheals, loperamide, those kinds of things, or their Imodium is the other name for loperamide. You could do those kinds of things. Make sure when you're hydrating, hydrate with things that's not just pure plain water. Make sure it has things like electrolytes in it, like Gatorade. We could talk about how much to hydrate. But my general rule of thumb is most of these food poisoning symptoms will go away on their own, hopefully within 72 hours. If you have symptoms lasting longer than 5 and 7 days, I would talk to your primary care doctor, primarily because you can get stool testing for ova and parasites or for common bacterial causes of infections. So that's the first reason why. And the other, if it's lasting longer than 7 days, the second reason to talk to a primary care doctor or an internist would be if you're noticing bloody diarrhea. That's the other major one. You worry about other things that can be causing symptoms like Crohn's disease or other things that are particular bacteria that need antibiotics can cause bloody diarrhea. And the last thing I would say, the reason to talk to your primary care doctor about food poisoning is if your symptoms are really severe. So if you're having severe abdominal pain, really can't keep up with the amount of diarrhea or nausea and vomiting that you're having, those are the three reasons why you should see someone about food poisoning.
Okay. And you touched on this really quickly. How much water should I be drinking in a day?
Yeah, I think it varies by size. Maybe the amount that I need is a little bit different than you, but in general.
Are you calling me short, Aaron?
No, I'm just saying.
Okay.
Yeah, I am your little brother, so.
You are, but you are much taller than me, so you require more water.
Probably, and so my general recommendation is like 3 liters, 2 to 3 liters. So what that looks like for someone might be 10 to 12 ounces glasses, and it could be water, it could be something like Gatorade. If you're feeling sick and you're losing a lot of electrolytes from, vomiting or diarrhea, then I definitely recommend Pedialyte or Gatorade, something that has electrolytes in it.
Okay. So can you repeat that amount one more time for me?
It's about 3 liters of
3
water.
liters of water. Okay. Okay, that's really helpful. And obviously, if you're feeling sick, just trying to get as much hydration as you can in there. The last topic I kind of want to talk about, and I think it's so perfect because you help us with this all the time, is you mentioned the urgent care for strep throat. I think a lot of people, and I get this question all the time, my kid fell off their bike and I think they broke their hand. Should we go to the urgent care or the emergency room? What is your answer for that? Because sometimes I don't know. So I call you to ask,
Yeah. That's a great question, and I think the answer is it depends. And
Okay.
I think oftentimes you have to think, why am I seeking care? So if it's something that can be a quick diagnostic test, like does my kid have sore throat, like a strep throat? Does my kid have an ear infection? Oh, they have a simple cut that needs simple sutures on their arm. Something that can be done quickly with limited diagnostics that probably can go to an urgent care. If it's something more severe, like a broken bone, I have chest pain, I'm not thinking straight, and you need more care, meaning you need to be seen potentially by a specialist, or need to have a procedure done, or need to have special imaging, like I'm having severe abdominal pain, I need a CT scan to look for appendicitis. Those kind of things should go to the emergency department. The caveat I will say is in the Chicagoland area, we have great health systems. And one of the nice things that they have here is that sometimes there's specialized urgent cares. For
Yep.
example, there's specialized orthopedic urgent cares. If one of your kids falls and breaks their bones, you can go to one of those. Or there's pediatric urgent cares. So those are some things to consider about, generally if it's quick and can be treated as an outpatient or at home, but you just need to be seen by someone to have it diagnosed, go to urgent care. If it's something more severe or life-threatening, go to an emergency department.
Okay, that's really helpful. I want to summarize some of the points we talked about here. We kind of started off by talking about infection, talked to the listeners about itises, so gastritis in their tummies, pharyngitis in our throat. We talked about pneumonias, which is an infection of our lungs. And basically the bottom line for all of those are they could be viral or bacterial in etiology, or the causes can be either viral or bacterial. And the treatment, if they're bacterial, you could get antibiotics. If they're viral, a lot of times they have to stay the course, talk to your doctor about it. There are vaccinations available for some of these things. Even if you feel like, oh, I'm still going to, I got the flu vaccine last year, I still got the flu, you should still consider getting it or talk to your doctor about getting it because it can lessen your symptoms. Particularly there are people that are immunocompromised or elderly or anything like that. You should definitely be getting your vaccinations. You're pretty much symptomatic. If you're symptomatic, you're probably still contagious. So if you have fevers, if you're having active stomach vomiting and diarrhea, you're contagious. And these you could be contagious a day before and not realize it, but definitely a couple of days after. So just be really careful and talk to your doctor about that.
And the key thing is to wash with soap and water, 30 seconds nicely. Some bugs like C. diff, a common intestinal infection, can only be killed with soap and water, not with
Hand
sanitizer.
sanitizer.
Like a hand sanitizer.
Okay, so make sure you're still washing your hands. And I'm guilty of that too. A lot of times I'm just throwing hand sanitizer on my kids. So that's a really good nugget at the end here. So make sure you're washing your hands with soap and water. And then kind of at the end, urgent care versus ER. If it's something that, can be like strep throat or something like that, urgent care. If it's life-threatening, go to the emergency room. And check out your local resources because you might have an orthopedic center or kids urgent care that takes walk-in.
Yeah.
So make sure you're checking your resources. And finally, 3 liters of water a day.
Yeah, and then things we didn't touch upon, sometimes these infections might need imaging.
Okay.
So if you have severe symptoms, fevers, or prolonged cough, you might get an X-ray or a CT scan that's done by your primary care doctor or by a healthcare provider. The 3 liters of water are really helpful also for other conditions, not just infectious. If you have kidney stones, things like that, sometimes being hydrated can prevent things like those.
Okay. Thank you, Aaron, for being here. That was really, really informative. I learned a lot, so I know the listeners did too.
Sure.
So thank you.
Thanks for having me.